right, listeners, buckle up, because today we're taking a deep dive into some really fascinating stuff, constructivist therapies.
Definitely fascinating.
You've provided us with a whole chapter from a psychotherapy textbook, and it's all about solution-focused therapy and narrative therapy.
Two approaches that really challenge the traditional ways we think about therapy.
They do. It's like they flip the script entirely.
Exactly. And they encourage us to rethink some pretty fundamental ideas about personality, mental health, even reality itself.
No pressure then, but it sounds like this deep dive could lead to a serious upgrade for my brain's operating system.
Well, maybe think of it more as expanding your awareness of how powerful your perspective can be, because that's really at the heart of these therapies, recognizing that each person constructs their world in a unique way.
Okay, now I'm even more intrigued. Let's start with the basics. What sets these therapies apart from those more traditional approaches we usually hear about, like psychoanalysis or CBT?
Well, one of the biggest differences is their focus on being brief, often lasting just a few sessions.
Wow, that's pretty different.
It is. And instead of digging into your past, they zero in on the present and the future.
So it's less about figuring out why you have a problem and more about figuring out how to move on.
Exactly. You have the power to create change in your life, and the therapist is more of a guide in that process.
I like that. It sounds incredibly empowering.
It is.
The chapter actually opens with a story about Diane, a high school senior, dealing with a tough breakup.
Yeah, her mom, who's a therapist, is ready for years of analysis, but Diane is like, nope, just give me some practical tools to move on.
And that's exactly what these therapies aim to do.
Oh, right. I see.
Meet people where they are and focus on solutions. The chapter mentions that Diane felt back in control after only 4 sessions.
That's pretty impressive.
It is.
It really speaks to the effectiveness of solution-focused therapy, which is a great place to start our deep dive. This therapy operates on the belief that people are inherently healthy, competent, and capable of creating positive change.
So instead of getting stuck in the problem, the focus is on what the person wants to achieve instead.
You got it. It's about identifying desired outcomes and figuring out actionable steps to reach them.
This therapy is future-oriented and action-oriented.
Exactly.
The chapter mentions this thing called the miracle question. It sounds almost magical. What is that?
Oh, it is a really powerful technique for helping people envision their ideal future. It involves asking, imagine you wake up tomorrow and all your problems are magically solved. What would your life look like? How would you feel and act differently?
I can see how that would be a game changer. It really forces you to shift your perspective and imagine what's possible.
It does. By engaging in this kind of thought experiment, you start to see those solutions that might already be within your grasp.
So it's like planting those seeds for change by first imagining the desired outcome.
That's a great way to put it. And solution-focused therapy really helps you define those clear, positive goals that can make it happen.
And the chapter lays out specific criteria for setting those goals.
Right, and it's all about making sure the goals are actually working for the client.
They need to be framed positively, focusing on what you want to achieve, not what you want to avoid. Specific, action-oriented, not vague.
Exactly.
So instead of saying, I want to stop feeling anxious, you might say something like, I want to feel calm and confident when I give presentations.
Precisely. It's about setting yourself up for success.
And those goals should be realistic, something within the person's control.
Absolutely. It's about focusing on the things you can actually change.
The chapter also mentions that it's crucial to use the client's own language, not fancy therapist jargon, when defining goals.
That's right. Empowering the client to express themselves authentically. The therapist is there to collaborate, not dictate.
This approach would really resonate with people who want to actively participate in their own growth. So how does a solution-focused therapist actually work with a client to achieve these goals?
One of the key strategies is shifting the conversation from problem talk to solution talk. So instead of dwelling on what's wrong, you're guiding the client to focus on what's working.
Even in small ways, right?
Yes.
I remember the chapter mentioning therapists asking questions like, when did the problem not happen? Or what are you doing differently during those times?
That's a great example. It's all about identifying those exceptions, those moments when the problem isn't dominating the client's experience.
Like finding those little cracks of light where the problem loses its grip, even for a moment.
Exactly. And then the therapist helps the client explore how to create more of those moments. How can they leverage their existing strengths?
There was another interesting thing in the chapter about approaching each session as if it might be the last. What's the thinking behind that?
It's a way to instill a sense of urgency and momentum.
Yeah.
From day one, the focus is on moving towards those solutions, not getting bogged down in endless analysis.
So empowering the client to take charge of their own change process.
Precisely. The therapist might ask, what small step can you take today to get closer to your goal? It's all about taking action, celebrating those victories along the way.
I remember this line from the chapter. Small changes can lead to bigger changes. It's like a ripple effect.
Oh, that's perfect. That's solution-focused therapy in a nutshell, creating that positive momentum.
And these solutions are as unique as the individuals, right? There's no one size fits all.
Absolutely. It's about collaborating to find what genuinely works for the person,
Right.
not imposing some predetermined plan.
This approach is incredibly powerful and empowering. It recognizes that you already have what you need to create change within yourself.
That's the heart of it. And it's not just for individual therapy either. The principles of solution-focused therapy can be applied in families, schools, workplaces.
The chapter even mentioned its effectiveness with mandated clients, those required to attend therapy, maybe by the legal system or something.
Right. It's really adaptable, and it can be incredibly helpful even when people might initially be resistant.
So the therapeutic relationship in this approach is more of a partnership than in some other approaches.
Yes, definitely. The therapist is there to guide and support the client's own exploration, It's a collaboration built on respect and empowerment.
This has been a fantastic breakdown of solution-focused therapy, and I'm already feeling my perspective shifting a bit. Now, let's dive into the other approach mentioned in the chapter, narrative therapy. I'm particularly intrigued by this idea that we construct our realities through the stories we tell ourselves.
It's a fascinating concept, isn't it? Narrative therapy suggests that our experiences are really intertwined with those narratives we create about ourselves and the world.
So if we change the story, we can actually change our experience.
It's not about denying reality, but rather about recognizing that our perception is always filtered through those personal narratives. Think about how historical narratives are constantly being revisited, rewritten to include voices that were previously silenced. It's about reclaiming your own voice, your own agency in shaping your story.
That's powerful. So how does a narrative therapist help someone rewrite their story in a way that's more empowering?
It starts with raising awareness of how much our stories are influenced by those dominant discourses, those unspoken rules and expectations that kind of permeate our families and societies.
Could you give an example of what you mean by dominant discourses?
Sure, think about those societal expectations around gender roles, career paths, even what it means to be successful. Those are all examples of dominant discourses.
So it's like these invisible scripts that we often follow without questioning where they came from.
Exactly. Narrative therapy encourages us to examine those scripts, to ask, are they really serving me? Are they aligned with my values and aspirations?
Or are they limiting my potential?
Exactly.
The chapter also talks about recognizing the power of the problem. What does that mean in this context?
It's a technique where you almost personify the problem, treating it as an external entity that the client is struggling with. This helps to create some distance between the person and the problem.
So instead of saying, I am an anxious person, you might say, I am battling anxiety.
Precisely. It's about recognizing that you are not your problems. You're a person with strengths and resources.
And the therapist would help the client to explore those strengths and resources.
Absolutely. One of the key concepts here is this idea of sparkling moments. Those times when the client resists the problem and acts in ways that are aligned with their values and goals.
I love that term, sparkling moments. It's hopeful and empowering.
It is. These moments, however small, demonstrate the client's agency and resilience.
So the therapist might ask, when have you felt most confident and in control? What were you doing differently during those times?
Exactly. Shining a light on those moments of exception and helping the client see themselves as capable of change.
The chapter mentions Mrs. C, a woman who was struggling with OCD, and her story is analyzed through this narrative lens.
Yeah, her story is a great illustration of how those dominant discourses can really shape our narratives. From her upbringing to her previous therapists, Mrs. C internalized messages about control, cleanliness, obedience, and these messages fueled her OCD.
So her need for order and certainty was a way of coping with those internalized messages.
Exactly. And through therapy, she started to deconstruct those messages and reclaim her own voice. She started asking things like, where's the joy? What about my own desires?
It's like she started to challenge the narrative that had been imposed on her,
Exactly.
creating space for something new and authentic.
Absolutely.
It's inspiring to see how narrative therapy can help people move beyond just talking about change, but actually taking action.
Yes, it really speaks to that power of reclaiming your narrative.
This is also fascinating. I'm already starting to think about those dominant discourses that might be shaping my own narrative.
That's the beauty of it. It invites us all to become more conscious.
So we've covered a lot of ground here, exploring both solution-focused and narrative therapy, and I'm already feeling like I have a whole new set of tools. But the chapter also includes some criticisms of these approaches, right?
It does, and it's important to acknowledge that no therapy is perfect or universally applicable. Different schools of thought have raised valid concerns about these newer constructivist therapies.
That makes sense. So let's look at those critiques, starting with the cognitive behavioral perspective. What are their main concerns?
Well, cognitive behavioral therapists, CBT therapists, really focus on identifying and challenging unhelpful thought patterns. So they might argue that constructivist therapies are too vague or too simplistic, that they don't adequately address those underlying cognitive processes that are contributing to the distress.
So a CBT therapist might worry that just focusing on solutions without addressing those negative thought patterns could be a problem.
That's one concern, yeah. They might also be concerned about the lack of rigorous empirical evidence for some of the techniques used. CBT is very research-driven.
That's understandable. But as we talked about earlier, not all therapeutic approaches can be easily measured using those traditional research methods.
That's true.
Like, how do you measure the impact of rewriting your narrative?
Exactly. Those are more subjective experiences.
Okay, so what about the psychoanalytic perspective? What are their main criticisms?
Psychoanalytic theory places a huge emphasis on exploring past experiences, particularly those from childhood, to understand those present-day difficulties. So they might argue that constructivist therapies, with their focus on the present and future, miss this crucial aspect.
So they might see these approaches as a bit superficial, avoiding those deeper unconscious conflicts.
Yeah, they might worry that just focusing on solutions is like putting a Band-Aid on a deep wound without addressing the underlying infection.
I remember that quote from Freud in the chapter where he compares brief therapies to cosmetics and psychoanalysis to surgery.
It really highlights that difference in emphasis, doesn't it?
It does. Now, what about the humanistic perspective? How do they view these constructivist therapies?
Humanistic therapy is all about the therapeutic relationship. So they might be concerned that these therapies, with their focus on techniques and solutions, could potentially neglect the importance of that human connection.
So they might worry that the therapist gets too focused on analyzing the client's story and not focused enough on just being present with them, validating their experience.
That's a valid concern. Humanistic therapists believe that healing often happens through that authentic connection with another human being.
Feeling seen and heard.
Exactly.
It's fascinating to see how these different lenses bring up such varied perspectives on these therapies. Where does that leave us? How do we make sense of all these different opinions?
I think the main takeaway is that no one therapy is perfect or right for everyone.
Right.
It's important to be aware of the different perspectives and to think critically about the strengths and limitations of each approach.
And ultimately, it's about finding the therapy that best fits your needs and preferences.
Exactly. What works for one person might not work for another, and that's totally okay. There are so many different paths to healing.
The chapter mentions an integrative perspective, which seems to embrace this idea of drawing from different theoretical orientations.
That's right. Integrative therapists believe in tailoring the treatment to the individual.
So it's like having a whole toolbox of therapeutic techniques and choosing the right tool for the job.
Precisely. It's about being flexible and responsive to the client's needs.
This has been such an insightful deep dive so far. We've explored solution-focused and narrative therapy, considered those criticisms, and touched on this integrative approach. Where do we go from here?
Well, the chapter goes on to analyze the case of Mrs. C through this narrative lens, showing how her story was shaped by those dominant discourses and how therapy helped her.
Sounds like a powerful illustration. Let's dive into that analysis next and see what we can learn from Mrs. C's experience.
Sounds good to me. You know, it's really quite interesting how these therapies approach change.
Yeah, it's like they turn the traditional model upside down. Instead of getting bogged down on the problem, they jump right to the solutions. It's a breath of fresh air.
It really is. It's all about recognizing that strength and resilience that we all have inside of us.
That capacity to create change, even when things are tough.
Exactly.
The chapter talks about how we're always solving problems in our everyday lives, even without realizing it.
That's so true. Think about it. We figure out how to deal with traffic, how to make dinner, how to navigate those awkward social situations.
We really are constantly adapting and finding solutions.
We are all the time.
But I guess sometimes we get so stuck in those negative thoughts or behaviors
Yeah.
that we can't see those solutions.
Yeah, that's where therapy can come in. It gives you that space to step back, gain some perspective, and tap into those problem-solving skills you already have.
And both solution-focused therapy and narrative therapy offer these really unique ways of doing that.
Mm.
One thing that stood out to me about solution-focused therapy was this focus on finding those exceptions to the problem.
Oh, it's such a great idea, even when a problem feels huge. There are probably times when it's not as intense or present.
Right. The chapter gives examples of questions that therapists might ask, like, when was the last time you felt even a little bit better? Or what were you doing differently during that time?
It's about guiding the client to see that the problem isn't this constant, overwhelming force.
It has its ups and downs.
Exactly, and understanding those changes can be so empowering.
Because it shows that change is possible. It's not about erasing the problem overnight, but finding those moments of relief and then building on them.
Exactly, identifying what's already working, even in small ways, and amplifying that.
It's like you're already using solutions without even realizing it.
Right.
And then you can use that to create more positive momentum.
Exactly. Solution-focused therapy is all about building on those successes.
I'm also drawn to this emphasis on using the client's own language, both in solution-focused therapy and narrative therapy.
Me too. It's so respectful and validating.
It is. It's about really honoring that person's unique experience instead of using jargon or interpretations.
Right.
The therapist is trying to understand the client's world through their words.
Exactly. And narrative therapists are really careful not to impose their own theories or judgments onto the client's story.
They see the client as the expert on their own life.
That's right. The therapist is more like a partner in the process, helping to uncover and reshape the narrative.
I love that. It creates this feeling of working together, which must be so empowering for the client.
It really is.
Now, as promising as these therapies sound, the chapter also acknowledges they might not be right for every person or situation.
That's an important point. No therapy is a magic bullet. And it's really important to realize that different approaches might be more helpful depending on the person's needs.
Right. The chapter goes into some criticisms of constructivist therapies from different perspectives. Let's take a closer look at those, starting with CBT. What are the main concerns?
Well, CBT therapists really emphasize identifying and challenging those unhelpful thought patterns that lead to distress. They might say that constructivist therapies don't pay enough attention to this.
So they might be worried that just focusing on solutions without dealing with those thought patterns could be a problem.
That's one worry, yeah. And they also might be hesitant about the lack of strong research evidence for some of the techniques used in constructivist therapy. CBT is really rooted in research, so they put a lot of importance on that.
That's understandable, but like we said earlier, not every therapy is easy to study with those traditional research methods.
Right.
Some of the benefits might be more qualitative.
Exactly. It's about looking at the limitations of those different research methods and understanding that something might be hard to measure but still really valuable.
Okay, that makes sense.
Yeah.
Now, what about the psychoanalytic perspective? What are their main criticisms?
Well, psychoanalysis emphasizes delving into the past, especially childhood, to understand those present-day issues. So they might say that constructivist therapies, with their focus on the present and future, are neglecting something crucial.
So they might view these newer therapies as sort of dismissive of the past.
Yeah, they might worry that focusing only on solutions without exploring those root causes is like treating the symptoms but not the underlying issue.
I remember that quote from Freud in the chapter. He compares grief therapies to cosmetics and psychoanalysis to surgery.
That really shows the difference in how they think, doesn't it?
It does. Okay, now for the humanistic perspective, how do they view constructivist therapies?
Humanistic therapy really prioritizes the therapeutic relationship, things like empathy, genuineness. So they might worry that these therapies, with their focus on techniques, might take away from that human connection.
So the worry is that the therapist might get too caught up in analyzing the client's story and miss those opportunities to just be present with them.
Yeah, just validating those experiences and emotions.
Right. Humanistic therapists believe that healing happens through that genuine connection.
Exactly. It's about feeling seen and heard, not just analyzed.
It's interesting how these different perspectives highlight different parts of these therapies. It seems like there's no one right answer.
That's a really important thing to remember. There are so many different schools of thought, each with their strengths and weaknesses. The important thing is finding the approach that feels right for you.
and being open to different ideas rather than being stuck on just one approach.
Absolutely.
Speaking of different approaches, the chapter mentions an integrative perspective, which seems to combine ideas from those different theories.
Yeah, integrative therapy recognizes that no one approach has all the answers.
Right.
It's about being flexible, drawing from different schools of thought to come up with the treatment plan that best fits the individual.
So like having a whole toolbox of therapeutic techniques and choosing the right one for each situation.
Exactly. It's about meeting the client where they are.
Okay, that makes a lot of sense. We've talked about solution-focused therapy, narrative therapy, those different criticisms, and the integrative approach. Now, the chapter goes on to analyze Mrs. C's case through that narrative lens, showing how her story was influenced by those dominant discourses and how therapy helped her to reclaim her narrative.
It's a really powerful example of how narrative therapy can work. It shows how we can start to unpack those limiting beliefs we might have internalized without even realizing it.
I'm really interested to hear more about that. Let's get into Mrs. C's story and see what we can learn.
I'd love to. Her story really shows the power of taking back your narrative.
Okay, so we're back, and I'm really interested to hear more about Mrs. C's journey through narrative therapy.
Yeah, her case is such a good example of how those dominant discourses can shape our lives without us even realizing it.
Right. The chapter talks about how these discourses were so deeply ingrained in her life.
They really were, and they were influencing her understanding of herself and her struggles with OCD.
It sounds like those dominant discourses were everywhere. Her upbringing, her pastor, even her previous therapists.
You're right, it's all there in the chapter. They all contributed to a narrative that was focused on control, cleanliness, and obedience.
It's no wonder she developed such a need for order and certainty in her life.
Absolutely.
It almost sounds like her OCD was a way of coping with all of that.
Exactly, a way of managing the anxiety that stemmed from all those internalized messages.
But then through narrative therapy, she started to really challenge those dominant discourses.
She did. She began to question all of those messages she had received throughout her life.
And reclaim her own voice, her own perspective.
Yes, and the chapter mentions how she started asking herself things like, where's the joy in my life? What about my own desires?
Such a huge shift in perspective.
It really is, you know. It's about separating herself from the problem, recognizing that she's not defined by her OCD.
And rediscovering those parts of herself that had been lost or silenced. And through that process, she was able to start creating a new narrative.
One that was more true to herself.
One that was more aligned with her own values and what she wanted for her life.
Right. And remember how she enrolled in courses at the university? That was a big step.
Oh yeah, that was a great example from the chapter.
It shows how narrative therapy isn't just about talking about change.
Right, it's about taking action.
It's about creating a life that feels authentic and fulfilling.
Well, this has been amazing, exploring these two constructivist therapies, solution-focused and narrative therapy. It's really made me think about the stories we tell ourselves, not just in therapy, but in life.
It's so important to be aware of those stories, aren't they?
They really are. Are they helping me or hurting me? Am I focusing on problems or solutions?
And do they really reflect who I am, who I want to be? These are questions we should all ask ourselves.
This deep dive has been so insightful. I feel like I have a whole new way of looking at things.
I'm glad to hear that.
Thank you so much for taking us through all this.
It's been my pleasure. And remember, you have the power to shape your own reality.
That's a great thought to leave us with. Thanks for joining us for this deep dive into the world of constructivist therapies. Until next time, keep questioning, keep exploring, and keep rewriting your story.